Hello, I'm Tanya Plibersek, the Federal Minister for Health, and I'm very sorry I'm not able to be with you in person today. I'm delighted to be able to send this message though, and particularly to welcome our international guests. I'm sure you're enjoying your visit to Broadbeach. Australia's made great strides in reducing the burden of cancer. Our cervical, breast and bowel cancer screening programs have made real gains in the detection and treatment of cancers. For the last 5 years, Australian girls have had access to free HPV vaccination, and from this year, hundreds of thousands of boys will also be vaccinated. This immunisation program will prevent the majority of cervical cancers and may also reduce other genital cancers. You'd also know that the government invests significant funding in cancer research through the NHMRC, our National Health and Medical Research body. For example, since 2008, almost $45 million has been committed to research into ovarian cancer, and the Australian Government's cancer agency, Cancer Australia, has been doing fantastic work on gynaecological cancers. In research, clinical trials and improving support for women with cancer. I'm pleased that Cancer Australia has been able to provide more than $2.5 million to ANZGOG to support clinical trials. I'm proud of the government's investment in the fight against cancer, but so much of our success is driven by a committed group of cancer specialists, including all of you who are participating in this annual meeting. As clinicians and researchers, you're steering Australia's path to discovery, innovation and best practice. We could not have achieved all that we have without you. Since 2000, ANZGOG has made sure that women in Australia and New Zealand have had access to the latest and best cancer treatments. In 16 trials involving almost 1,500 patients, ANZGOG has improved outcomes for women with gynaecological cancers. I'm a very strong advocate for clinical trials, and I'm committed to improving Australia's international competitiveness in this area. To help with this, in February I announced funding to address issues of cost and timeliness of clinical trials. In closing, I want to congratulate you on your work and wish you a very successful meeting. I look forward to hearing the outcomes of your discussions. Thanks.